Just tell you a little bit about myself. I'm here in Region 5. I've been here only just about 5 or 6 months now. I've worked with Treehouse for 4 months. Like Mickey was saying, this is a new program, and it's a replication of the program from Seattle. So we're getting real busy, and it's just a really exciting program and a real exciting means for the kids in our care to get the help and the assistance that they need. One thing about this training, I think it really leaves out an awful lot of other issues that we deal with, like the discipline and transportation issues when kids are moved from place to place. And I'd like to talk a little bit about that too if there's time. So a little bit again about me. I'm from Region 2, which is the Yakima area. I've been over here about 4 or 5 months. I used to work as a BRS case manager. So how many do you know what that means? Okay. It's Behavior Rehabilitation Services. So I am pretty familiar with a lot of the issues that some of the kids in care have that have multiple moves. But on top of that, I'm also a foster parent. And I have been a foster parent myself since 2001. And on a personal level, have come up against so many of the issues that I'm sure each and every one of you have. Just by a showing of hands, how many people are with private agencies? Private agency foster parents? Okay. So that's like Catholic Family, Kids Sense, Youth for Christ, Catholic Community. So how many are DCFS parents? Okay, so it's a pretty good split. Okay, caregivers in education, the best thing that we can do for our kids is to be involved, stay on top of their homework, encourage learning. We can read, there's a home environment that encourages learning is more important to student achievement than income, education level, or cultural background. So just encouraging the kids and being there, staying on top of them a little bit, turning off the TV, turning off the video games, is so much more important, and placing a big emphasis on educational achievement is more important than, having a Mercedes in the driveway. Parent involvement factors such as reading to children, holding high expectations, guiding TV watching, or in my house, we just don't allow it. Asking about the school day contributes significantly to classroom achievement. I found a new technique in another training I attended recently, and I was just really taken by it, and my kids just love it. And when I get home and we have time to spend together, I ask each of them a question: what did you do that you're proud of today at school? And that has been a really powerful motivator for my kids that, we sit down at the dinner table and we're chit-chat, and if I forget to ask them, they say, Mom, you want to hear what I did that I'm proud of today? So that's a really cool thing. And it could be something as little as, I didn't have to sit in the hallway today. So, okay, all right. I picked up somebody's tray at lunch. So it's an individual thing. Caregivers play a key role in the day-to-day academic success of children in their care simply through creating a home culture that values education. That's kind of a repeat. Ways that we can support advocacy. Of course, we got to make sure the kids go to school and they go to classes. That's kind of a no-brainer. Communicate regularly with the school and the social worker. Participate in school activities, homework, parent-teacher meetings, and extracurricular activities. That's a big mouthful. It's easy to say, but that is a lot of work there itself. But that's what we do. Assume responsibilities agreed upon in the education section of the ISSP. Identify and communicate any educational needs that arise. Build relationships with the school and teachers, and stay involved with our students. Okay, the IDEA. Has anybody heard of that before? It's the Individuals with Disabilities in Education Act, and it deals specifically with special education, or Improvement Act, excuse me, a federal law enacted to ensure that students with disabilities receive meaningful educations through the 12th grade. A disability can be defined as any impairment that interferes with a student's ability to learn. We all heard the term IEP. Anybody not familiar with what an IEP is? No, okay. a document that describes the specific special education services, a free and appropriate public education, a FAPE, and least restrictive environment. Okay, so those are a lot of the terms that you'll come across. Important things to know. Who is a parent? This one is something, how many of you have attended IEP meetings? Did you feel like an idiot? I've attended several IEP meetings before I got some more advanced training, and I just really did not feel I had a handle of what was going on. Or thumbing through an IEP, I was very confused, and I felt very disadvantaged in some of those meetings. And I mean, I don't know if any of you have felt that way. And if anybody ever needs someone or feels they need the assistance to have someone monitor an IEP meeting, talk to your social worker and get a referral, and we can help you with that if you don't feel that the kids in your care are getting the services that they need. Technically, the schools want to communicate with the birth parent. One thing that you do need to know, as a foster parent, you do have the right to sign an IEP. You do. Okay. Okay. Why would okay? Then sometimes some of the districts will want to be a little bit more sticky, and they're going to want a more formal document assigning a surrogate parent. You certainly have the right to step up to the plate and be designated as a surrogate parent while a child is in your home. The IDEA 2004, which is the newer version, states that a judge can appoint a surrogate to a child. I don't think it necessarily has to be a judge. I think it can be the district personnel. But the clarification on some of these, the newer version of the IDEA 2004, haven't trickled down to the administrative codes or the rules and regulations yet. So that's kind of yet to be defined. And even the school districts can be very confused about who technically can sign an IEP or who can be a surrogate parent. Yeah?
I went to a PACE training probably 4 or 5 years ago.
Yeah.
And they were saying foster parents can't sign the IEP, partly because if the child's a dependent of the state, they need a legal custodian. So that the foster parent didn't qualify for that. I mean, the child could be moved from that home tomorrow. Right. So they always were saying you needed to have a state worker or somebody as a guardian.
But there's also a conflict in that, because they're saying that there's another whack in there. See, this is where there's some gray areas, some conflict. That a state worker can't be designated a surrogate parent. A state worker can't sign the IEP. You know, I mean, not as the parent, not in the parental role. They can sign it, but not as the parent. You can sign it as the parent or the custodial caregiver, but a social worker cannot. And the more people that sign it, that's fine.
Right.
But again, and that's some things that they're kind of working out in the newer version of the Act. Okay. Yeah. So you'd say current law is inconsistent, very confusing. And, you know, half the time the teachers don't know, the special ed people don't know, and so, okay. Eligibility under the IDEA, hearing impairment, visual impairment, autism, brain injury, orthopedically impaired, developmentally delayed, emotionally, behaviorally disabled, health impaired, specific learning disability, communication disordered, and of course mental retardation. Steps. This can be very confusing too. You feel you have a child that needs special services, and they're not getting what they need. Anytime that you communicate with the school about a desire to have an individual tested or a child tested, do so in writing. Keep a copy. They can be referred by the school. They can be referred by the family. They can be referred by anyone that knows the child. I've even actually in one situation I had a teacher make a referral, which is kind of unusual, but I was pretty jazzed. The testing, once the referral is made, I don't know if the next thing has the timeline, but the timeline process can be very confusing. The referral is made, it should be made in writing, like I said. You should take it to the special ed coordinator, or I address mine to the principal. When that's accepted or when they receive it, they have 25 working days to make the decision of whether or not they're actually even going to test the child or test the student. 5 weeks before they even decide. Once they make a decision, yes, they will, or no, they won't, they have 6 weeks, 30 working days to actually get to the testing. So the sooner that you feel that this child or a student in your home is in need of an assessment, jump on it. Sometimes the schools will jump on and do it much quicker. Yes?
Now, I understand that the parent can say, I need to have this child tested, and they have to give them an assessment test.
Yeah, but they can do it in their own time frame.
We called Washington, D.C. Yeah. It was the next week.
Well, yeah, there's always end runs. You can always get around rules and everything. I actually sat in one meeting about a student. It wasn't an IEP meeting. It was just a meeting talking about this young lady's achievement, her progress, and her school history. And that was on a Thursday morning. They started testing the following week. And that was here in Tacoma. So I'm pretty impressed. They have that big window, but they don't always use it all. It depends on the districts, it depends on the school, it depends on their caseload, and sometimes it just depends on whether they feel like it. So it's just sad, but it's true. Okay, the evaluation, the school-based written description of the present level of educational performance, which outlines the student's strengths, weaknesses, and learning styles and needs are included. An IEP is a detailed description of the specific instruction and services a student with disability needs in order to receive a meaningful education, tailored to the individual child. And these things all included in this document can be very confusing, and the format can be very awkward to negotiate and navigate around and figure out what they're saying. And sometimes they use terms that are complicated, and they use a lot of acronyms, and it's confusing, and I have found them confusing. I mean, I don't know about you, but I have found them to be somewhat confusing. An IEP must include measurable intermediate steps between a student's present level of educational performance and the annual goals that have been established. So if a student is, say, functioning at a second grade reading level, then that has to be stated there. And then the goal for the year is to get them to advance to another certain level. So it has to be stated very clearly. If there's anything in an IEP that you don't understand, ask it to be clarified, and ask it to be clarified before it's signed, or before you put your name to it. How the child's progress will be measured and reported, descriptions of all the services and accommodations a child will receive, such as preferential seating, more time for testing, open book testing. There's just tons and tons of accommodations that can be made. Sometimes, we just have to be creative. Like one, especially like with EBD kids, they have trouble passing in the hallway. They're always getting in fights, and then they're getting kicked out of class, or they're getting sent to in-school suspension or expelled. And it can be as simple as having them leave class 2 or 3 minutes early before everybody else does to get to their next class. So, or buddying up with a pal to get from class to class. The location, duration, and frequency of services to be delivered has to be specified, has to be spelled out. The description of transition services for students at age 14 or older, and this with the new IDEA 2004 is going up to age 16. Okay. Do you have any questions about any of this?
What does that last one mean, description of transition services?
Some of the kids in special ed have more severe needs than others. Some kids, I hate to say, I hate the whole concept of low expectations of kids. But in reality, some kids are never going to go on to college. Okay, so a plan for their future education post-high school has to be described, like vocational training, life skills training. Is that helpful? Okay.
And in the foster care system, there are independent living skill opportunities available for kids that are a little bit older. So you not only can take advantage of them through IEPs if you in fact have one for a child, but then they're also readily available to all foster kids whether or not they have an IEP or not. And
right.
I think there are local providers who provide those services.
And you access that how?
Social worker.
And if that fails?
Social work supervisor.
Okay. I've been trying to do that one.
Yeah, if you have a child in your home that's over 14, you can make the referral. They don't necessarily act on it until they're 16 or whenever the social work.
Are you 16?
office. Yeah, they should be participating in some kind of life skills training. They teach them to balance a checkbook. They teach them about looking for an apartment and paying rent and making a budget and navigating the bus system and a lot of useful day-to-day activities.
Is that only for children with an IEP?
No, no, no. Any kid in foster care, or any student in foster care.
But there are specific services with an IEP. They
Right.
help with transition, but then foster care has its own independent living skills.
Right. You could kind of double up the services when you have an IEP. You can get some right in the school in addition to outside the school. So.
Just a comment on the independent living skills.
Uh-huh.
Social worker recommended my older daughter, she's 17 now, for independent living skills.
Yes.
And I had a lady contact me,
Uh-huh.
but they want to talk to the child themselves.
Absolutely.
And the child has to agree to do the program, and she opted not to, no matter what I said. And I told her it would help and would benefit her, but she didn't feel that she needed it because she thought I was providing what she needed, the busing and the stuff like that. And that's the child's prerogative to say no. So just because you ask for the assessment and you get it, your child's going to have the right to say, no, I don't want to do it.
And that's a really good point. And, some of them don't need it. Some of them are perfectly able to learn those things. They have a caring caregiver, someone to teach them. But some incentives that the ILS programs have is that they pay them. They give them $5 to show up. So I mean, at least the ones in Yakima, yeah, they give them $5 every time they leave class once a week. So, or they give them like a gift card at Borders or something. So, and I know that some of the mental health programs do too. So, okay, questions. What academic and occupational skills will the student need? And one thing I do want to highlight, though, is the student's strengths. And a lot of times in the IEP, students' wants and desires and the things that they're good at are not stressed enough. Okay, sometimes a child is a really good reader. I attended a meeting this morning where this particular young lady really was good in dealing with kids in her high school that had severe disabilities. And she helped at lunchtime with feedings. She helped them in the classroom and got credit in a class for that. So that was a real strength for her. And also she was taking English or American Sign Language. And so, they were really building on those strengths for this kid who just had a really tough first 14 years. So.
I did not pay her to say that. She did it on her own volition. We've been talking about strengths-based in the morning.
Oh,
so
yeah.
it was just a nice thing to come back to, that you were saying capitalize on student strengths.
Well, and sometimes it's really, really hard as foster parents, as parents in general. These kids, they just drive you crazy some days. Absolutely nuts. And you feel like they're out to drive you to the mental hospital. And you have to remember to look for something in them good. And that's why I really like that question. What did you do today that you're proud of? And it's amazing what kids will come up to tell you. I mean, kids from 7 to 16, 18, they'll really be very creative, and they'll really surprise you. And then occasionally they'll turn around and say, well, Mom, what did you do today that you're proud of? I was like, I don't know, I have to think about that. Okay, we talked a little bit about the referral and evaluation. There's going to be some changes between the 97 version of the IDEA and the 2004 version. This particular print on your PowerPoint did not copy very well, so it's pretty dark. So if you want to put in the 2004, this is going to be the newer model, so you might want to make a note of that. I guess anyone can refer a youth for an evaluation was the 97 WAC, and now they're saying only a parent or school can refer youth. I'm stymied by that one. I think that's really very intimidating, and I hope to see that change or perhaps be reinterpreted. The timeline for evaluation, 60 days from the parental consent. And I'll have to double check, but it's my understanding that the foster parent can give the consent if the biological parent cannot be found. Sometimes if they can't find a biological parent or identify a suitable surrogate, you could get a court order. So For specific learning disability, evaluation can involve using a process to determine whether child responds to scientific research-based intervention. Okay. Okay, and another thing that happens a lot is kids get referred in one district and then they move to another. That happens all the time. The timeline needs to follow the student. So if it starts in one district, the new district has to pick it up and carry the ball. They can't be dropping that ball.
So when they send the transfer papers, do they also send that referral?
They're supposed to. In a perfect world. I mean, I don't know how many of you have had new children come into your home and then not be able to get them enrolled. Or then they attend school, or they finally get into school and they're not getting any IEP service. It's like, it happens. It happens a lot.
Yeah, so a good question might be, when a child comes into your care, is this child being assessed for an IEP? Or does this child have an IEP? So that you can continue to follow up with that, even though technically you should just be automatically informed, but in reality we know most of the time you have to go after the information, so something to keep in mind.
Are the kids very good at passing the information along?
And that's exactly what I was going to say. You need to ask them, what did their school day look like? You know, what did you, okay, tell me about how your old school worked. What did you do during the day? And, you know, for a smaller child, if they say, okay, well, I left the classroom and I went with so-and-so classroom, I did this, then you know maybe they're doing a pull-out thing. So asking questions. I think that kids are not involved enough and that we should always ask them first. Okay? They don't always tell the truth. It's not always reliable, but it's a good idea, and it makes them feel good. Another thing is strength-based. You know, you got to give the kids some credibility, and you have to have high expectations. Okay, this one may not have photocopied very well either. The old versus the new IDEA. Let's just talk about the new. IEP reviews must be held annually. Oops. Allowed excusals to members of the IEP team. That means if someone can't attend, it's not that big a deal. Sometimes it moves from foster parent to foster parent, so they need to revise the team revise the names on the IEP team. Changes can be made without changes to the IEP can be made without a meeting if the parent and the school agree. This one's a little bit of a sticking point. There's some people that are really happy about this, and there's some people that are really unhappy about it. And any time that perhaps a school calls you and suggests a change, demand it in writing. You may agree to it wholeheartedly, but demand it in writing so that you know specifically what they're saying and that you can provide copies to the social worker, because they won't, or any other interested parties. Okay. The re-eval is no more than one per year, and usually they're 3-year. That doesn't change an awful lot. Transition services, again, I said they're moving them up to age 16. Any questions about that?
Yeah. If you think your child's been, if they've been evaluated and you think they should be reevaluated and you haven't hit the 3-year mark yet, can you ask that they be evaluated for something specific?
Absolutely. Absolutely. Whether they'll do it or not, or they'll do the actual testing again or not, it's hard to say. They have to do the physical, psychological testing every 3 years.
Right.
Whether they'll retest them again or they'll review their records. That's kind of the sticky
What would
thing.
the process be? Would you put it in writing?
I always
and then
put everything.
How many days do they have to
decide if to reevaluate or not? Mm-hmm. You know, a lot of times it depends on how good of a relationship you have with your schools. You know, when I enroll a new student into my local school, I mean, and at Christmas and at the end of the year, I make sure that I take chocolates to the secretary, you know, or cookies. I mean, and I go in and I am as nice as pie to that secretary, that school principal, the playground lady, all those people, anybody that I can, because I want to build a relationship with them. I want them to see me as a friend, not a foe. I want them to be my partner, not my adversary. I do not want to do battle with them because they're big and it's just me. So I just try to be real nice. You know, I schmooze. But for a reevaluation, I believe it's the same timeline. They have, I would always put it in writing.
Okay.
They can agree or disagree. the school psychologists oftentimes are part-time people, and within a district and go part-time from school to school. So it's hard to say. But if you're chummy with them, sometimes they'll do you favors. And hard to say. But a lot of it does. It depends on relationships. I hate to say it, but it's true.
I notice how it has reevaluations must be held every 3 years. And I know that I have a lot of IEPs, and the kids graduate the levels that they're on. So are you considering that they just make amendments for these IEP? Or, because sometimes I could get a child in my home who's severely developmentally delayed, but usually because of environment.
Sure.
So they start off with a very strong IEP, and then they grow really quickly when they get in the right environment. So in that type of situation, is it okay to reevaluate as fast as they're progressing?
The formal reevaluation process, the every 3-year one, includes the psychological testing. Okay? The interim reevaluations generally will include a review of records. Okay? If you disagree with the goal or you think a goal has been met and it's no longer useful, sure, that's when changes can be made with if the parent and student agree, or the parent and the teacher agree. Parent and the school agree. Somebody agrees. So, does that?
Because we usually do the reevaluations every year.
Yes.
With the younger kids.
But okay, let me see if I understand this right. You're saying if you want to do it more frequently, or you find a goal like, say, at Christmas time, and it's no longer useful, can you change it then? Is that what you're asking?
No, I'm talking about on one of their IEP programs is to button their pants.
Okay.
And they met that need.
Sure.
And they button their pants, and so they got to go on to the next one. That's what I'm saying. How come? I was just wondering why the 3-year marker was there.
It's just a standard average. That's when they redo the actual testing, the psychological testing. They have them do the.
Okay, thanks.
Does that make sense to you now?
Yeah, now I got it.
But goals
Okay.
can always be amended or discarded. If they're met, boom, they can be deleted. Or you can just make a little note on there. This goal met, and on an addendum, add a new goal. Okay. Yes.
It occurs to me that there are children that have excessive mental capabilities as well as ones that are disabled.
Correct.
And to be in an environment where those capabilities are being stifled is just as difficult for them. Are there programs to help these kids advance at their rate?
Gifted programs?
Yes.
Absolutely. Usually the same types of laws and timelines don't apply to the gifted students, and there's not the mandatory inclusion oftentimes in gifted programs. I happen to have some direct contact with some kids that are going through the process for the gifted or entry into the gifted program in South Kitsap. And it's there's a sibling group, 2 kids, one's 7, one's 10. So one will be going into the 5th grade next year, one's going into the 2nd grade. The program for enrichment did I say 2nd grade? He's in the 2nd grade going into the 3rd. So that's when the enrichment program actually begins. So they take the top 100 kids or kids that have been referred for the testing, do the testing, and then they whittle that number down from 100 to 60. Then they do an additional test at the child's school, whittle that number down a little bit more. Then they do a 3rd round of testing and whittle the number down to 25. And that's the cohort that those children will follow all the way through, I believe in that district, through the 9th grade.
That's sad.
It is sad. That is sad. And believe me, I think that there's a lot of kids that are underserved or not served. But get this, this family moved from another district. The child that's currently in the 4th grade testing to go into the 5th grade program had previously been in a magnet classroom with the top 25 kids in the district all the time, moves over, there's no room. No room for her. She has an IQ of like 140. Okay. She scored in the 99th percentile of the full range IQ test. No room. That's all they can handle. That's all there's money for. But so anyway, they are testing her and about 40 other kids for one of 3 spots because people have moved out of the district or have opted out of the program. And the same rights don't apply to those kids. And it's very, very sad. Okay, Section 504. Now, Section 504 is kind of one of those crazy animals that people really don't know anything about. Does anybody here ever have or have a child that's on a Section 504 plan? I knew you would. Okay, you too. Okay. And Section 504 is pretty much like IEP. The only difference is there's no federal money for it. The same accommodations can be made, the same assistance can be given, but there's no federal matching dollars. Okay? And it's a lot less informal as far as getting a child serviced under that plan, because you don't have the serious timelines, you don't have the higher level of criteria. So anyway, let's read this. 504 is an anti-discrimination statute which requires that the educational needs of a disabled student are met as adequately as the non-disabled. The 504 plan, there's no federal money. It follows a different eligibility process. It's a lot easier to get into. Students would not receive both special ed and 504. Accommodations provided in the general ed classroom, responsibility falls to the general public education system, so this child wouldn't be considered special ed. And similar protections around discipline. This is the key thing. A lot of the kids that we have in our homes have discipline issues. Well, I had one little guy, I still have him, bless his heart, but he would get mad and he would grab a kid, throw him down, kick him, and then run away. And unfortunately, he wasn't on an IEP, so his discipline, but I mean, another thing, that the school district was really good about working with him, so I was fortunate, but a lot of kids would be expelled. And they would have to have an emergency expulsion meeting, yada, yada, and they say, no IEP, bye. Okay? So a child with an IEP has a lot more protection when it comes to discipline.
It says no federal funding provided for a kid on the 504. What type of funding do they get with an IEP?
Now, I'm not a funding wizard, but it's my understanding that once a year there's a census of special education students in each district, and I think it's either in October or January, depends on the district. They count up all their special ed students, and then they tell the federal government, this is how many students we have. That is how they determine their funding for the next school year. Okay. Generally, I believe it's around, I mean, don't quote me, and each district would be different. It's around $11,000. Sometimes it takes much more to educate a special education student. And sometimes it doesn't take that much. It depends upon the degree of their disability. So some of these 504 plan accommodations can be visual assistance, preferential seating, handouts, big typefaces, okay, extra time, tape recorder, so that the notes can be taped. Someone taking notes for the student, or the student being provided a copy of the lesson plan. Okay? They can be very, very low-key. Okay?
So is the funding based on each student's needs? Every student might get a different funding amount?
Yeah. If it's determined under a 504 plan that the child has, or it's not determined under the plan, but the child comes into the district, they have a visual problem. I've seen some districts buy a special computer software program, and they can be thousands of dollars to assist that student. It can be speech activated, or hearing, special hearing, the typing boards. I mean, there's just a lot of different accommodations. It depends upon how it's impacting their learning. But it just comes out of a different pool of the district's money. So it doesn't come out of the federal funds. And I think that's called Title I. Major life activities, the learning, seeing, speaking, caring for oneself, walking, hearing, breathing, or performing manual tasks. There's no questions about what the accommodations or what the disabilities could be. Pretty much the same as under the IEP. And how does it work? And we kind of talked a little bit about this already. They have an obligation under Child Find. Has anybody ever heard of Child Find? Okay, so they really go and try to seek out students before they're entering the school district and give them assessments and determine their needs. It's a great program. Each school has a 504 committee which determines the qualification. Unlike the Individuals with Disabilities in Education Act, or Improvement Act, no set list of people to be on the committee, parent not required to be part of the committee. And best practice always dictates, of course, that a parent be involved, if at all possible. Okay, parental consent is required before the initial evaluation. If a student is determined eligible, the 504 committee will create a plan, and they call that a placement. Where would this child be placed? What accommodations they will get and how they will be provided. And general ed classroom. Periodic reevaluation, no clear timelines, but every 3 years is considered compliant and best practice. And anytime that if you see that perhaps their needs aren't being met, in writing, make a referral. Okay, possible accommodations. We talked a little bit about this. Here's a little bigger list. Study and note-taking habits, use of teacher notes and agendas, peer notes, keyboard, tape recorder, a behavior management plan, sometimes some de-escalation techniques, a safe place for a child to go, early passing time in like a junior high through the hallways. It can be very simple, no-cost type of accommodations. Extra time on test, maybe a quiet space to take the test by themselves, someone to read the test verbally to them. They have to read them verbatim. Grouping, buddy system, manipulatives to reduce distractibility, a specialized chair or cushion. Can anybody think of any others if you've seen? Oh, okay, yeah.
Step stool for a child that was
short
in stature.
Sure, yeah. It's going to be simple. An accommodation can be as simple as a step stool. Okay. Okay. And that's the end. We have time for questions.
It's my understanding that there was a study done, and I can't remember if it was Pierce County as a whole, and what they were looking for is the correlation of IEPs with socioeconomic groups. And I was told that they found that the percentage of IEPs in all of the schools had a range of 11 to 12%, or 11.5 to 12% in there. And that one of the things that came out of that was because the government only allows for a certain percentage to have IEP, and then they get no more money. And it was like 11.5% or 12%. Is that correct?
That's not something that I really know anything about. The funding stuff, I'm not real savvy on. I imagine they do put some caps in the schools that, yeah, a certain percentage of the population is a maximum to be deemed special ed. I wouldn't doubt that. Can I verify it or confirm it? No, sorry. But that's a really good point. Yes?
Yeah, I have an understanding that the IEP or the 504 plan carries on with the student into junior college or a college that they go to, and if the college is aware of that they make also special accommodation. Do you find this to be true?
Yes. Matter of fact, I went to college with a gal who was legally blind, and they made a lot of accommodations for this student. And I don't know that it would actually transfer from one place to the other, but when a student is, old enough to go to college, a lot of times they've learned self-advocacy. So they can go to the enrollment, they can go to student services, and they say, I need this, and it's done. Not automatically done, but...
Can you talk a little bit about how to access Treehouse services and what you can do for foster families?
Sure.
Or did you talk about that?
No, I didn't. I have a couple things to talk about. Actually,
okay.
Remind me to talk about the discipline because that's not touched on at all in here. To access the Treehouse services, there's on the education advocacy brochure that I handed out, if you have a need or you feel that a student in your home has a need for advocacy services, the social worker has to make the referral. Okay, it's a simple referral. They do it online. They send it to the program manager, and she sends it back to whichever region this child happens to be in. I have counterparts in the whole state, which is kind of cool. So if I have actually a child in the Tacoma office that lives in Spokane. So I went for my counterpart, got the records that I thought she needed out of the case file, and sent them over to her. So you're not geographically limited in this service. There's other services that Treehouse provides, and typically they are in King County only. They have what's called the Little Warehouse, or the Little Wishes program, and they fund like camp, musical lessons, dance lessons, kind of fun stuff. I know that they have some money for camp, so if you have a child that's currently receiving educational advocacy services, and you thought or you think they might be a good candidate to go to camp, then you can make a referral and your social worker can access those funds.
In Pierce County, there's a fund through the CASAs.
Oh, great.
For camp and musical instruments and things. Not all kids will qualify because the fund isn't that big.
Right.
So if you're interested in donating, let me know, or any of the CASAs will put it in the fund for you, or we can show you how to get it there. But that's a source locally that we have.
Great, okay. That's good to know, because I am new to the area and I don't know a lot of the resources.
There's also a resource for grandparents who have kids in their home for camps and for musical instruments
Right.
and that sort of thing too.
Well, that's always good to know. So, okay, so Little Wishes, that's kind of more tangible goods. Also, there's a store, the Treehouse store. It's called the Warehouse, and it's WEAR House. And they've got it set up. They've got new or very lightly used clothing and toys. And the students, and this is King County only, unfortunately, but the students are able to go in and go shopping 3 or 4 times a year. They get, depending on their age, they have a little list of things that they can get. They can choose like 3 or 4 pairs of pants, 3 or 4 shirts, a couple of toys, and different types of items like that. So it's a really great resource.
Treehouse services, you're right, they're for King County. If the child is out of King County, their DSHS worker is
Right.
out of King County. The child can be residing anywhere.
That's right.
But their DCFS worker has to be King County in order to access all the other Treehouse services
Right.
other than your program.
Right.
Pierce Kitsap County a few years ago tried to develop a counterpart called High Five for Kids.
High Five, and High Five is still active, from my understanding. The education lead here, I thought, still
You're right.
did that.
It's here, and
Yeah.
they have less resources, but
Right.
there's still. I was on the planning committee for it to try to duplicate what Treehouse provides, but for Pierce County and Kitsap County kids.
So how's it going then?
They have. Is it still going? It's Little Wishes. Right. Okay. So there's less services, but it's still there's something there.
There's
you know.
something.
Yeah. Yeah.
It's up to $50
Right.
for Little Wishes.
But like the warehouse and stuff is only if the child could be living in Centralia, but if
Right.
they have a King County worker, then they can get Treehouse services.
You just got to get them from Centralia back over to the warehouse.
Which I've done.
Yeah, and it could go back both ways. If they have like a Region 5 kid or a Region 2 kid that lives in King County, then they can also access the services. So, yeah, it goes both ways.
There's one facility right here in Tacoma. It's St. Vincent de Paul. They have an angel house.
Oh, great.
And I take children down there, and they get, especially when they start turning 18, they get bedding and beds, tables, chairs, and stuff like that. It's a voucher system.
So that's kind of like for transitioning out of
Correct.
foster care.
But they can also get clothing and everything else down there. And a wonderful
That
agency.
sounds great.
Yeah, that's on 56th South Tacoma Way.
Great. All right, that's always good. How many of you have issues or have had issues with your children being suspended or expelled? Okay. And one thing, I mean, this is a great training, but I don't think it's some of the real day-to-day things that foster parents deal with are discipline, okay, and the school disciplining them. When a child is on an IEP or on a 504 plan, they do have enhanced protections under the law. A child on an IEP cannot be suspended, and this is something you really need to know, more than 10 days in a school year without an addendum to the change or to the IEP. There has to be a change in placement. A lot of times there are informal ways that a child is suspended. It doesn't happen as much like in high school, but the littler kids, they'll say, oh, you need to come and pick up Josh today. He's really acting out. And anytime a child leaves their school, that's considered a suspension, whether the school documents it as such or not. And then there are certain limits to the time that the school district is allowed to exclude that child from education. So if you have a situation where there's an emergency expulsion or where you feel there's excessive discipline of your foster child, they are on an IEP or you think they should be on an IEP, then definitely access your social worker and request a referral be made.
I think I remember seeing that there's only one evaluation allowed. Is it in a year?
There's only one psychological, when they do the full testing, it's every 3 years. They generally redo the IEP formally once a year. But, and like it was changing between the 97 version and the 2004 version of the IDEA. But if there's a needed change or there's excessive discipline, then we need to convene an IEP meeting and figure out new goals, a new behavior intervention plan, or a functional behavior assessment.
And the child is incorporated in that meeting so that...
They should, it depends on their age, but they should be, yeah, I think. And, yeah, they should be.
Yes, in this reevaluation process, and a student goes from IEP to a 504 plan, what's the probability of going back to an IEP?
Depends on the student's progress and their interests.
And so they can go back backwards? Okay.
Sure, and they can exit out of IEP if they want. I've got a friend who worked very hard with her student, came into her home at age 13, reading at a second grade level. Okay, he's now a sophomore reading on target 3 years later. Okay, she's worked very hard. He exited out of IEP last year. So, plays football, the whole thing. Very obvious case of an environmental deficiency. Okay, any other questions?